Now let's come back home to Nigeria, or Africa, I might say, for the continent, and look for investment opportunities, not just in the market, outside the market. There are some opportunities for investments, and one of that could be the health sector, health technology sector for that matter. As you know, health is the first wealth that you could always have. So looking at the continent, I mean, when we're talking about the AFDB, we talked about infrastructure financing, which has also affected health, welfare, and welfare of employers and productivity. So now let's see if the private sector could contribute to this. And joining us for this conversation is Zila Waminaje, is a consultant with Salient Advisory, joins us virtually from Abuja. Hi, Zila, good afternoon.
Hello, good afternoon. Happy to be here.
Yeah, good to have you here. So tell us what opportunities we have in the African health tech sector, not just the health sector, but the technology sector.
Yes. So last year in 2023, we tracked, we're able to track about 114 African health tech innovators who are operating on the continent, and collectively, this group of innovators raised $169 million in funding across 145 deals. And when you compare this data with that from 2022, it's just a 2% funding decline. And overall, the African health tech innovators actually proved resilient in the past year compared to other sectors in the tech ecosystem. Bigger reports posit that the broader tech ecosystem had about 39% funding decline. So we see that investors are heavily betting on these African health tech innovators. Solutions that stand out are the online pharmacy operators and also the electronic medical records innovators.
Yeah, very interesting, because I wanted to ask you, is it just about the apps? So when you say online innovators, tell us about how do these things work? I do know that there's a new system now where doctors especially can connect with doctors who are more exposed or experienced than they are, and that's using technology, and they can treat people right. So tell us more about the details of these available opportunities.
Yes, that's actually an exciting one. A popular solution in the health tech space is the telemedicine solutions, which allow patients to be able to talk to doctors. But we're also seeing these innovators, develop solutions that enable healthcare providers to collaborate better with some senior consultants in their space. And where we're seeing this happening a lot is actually in the diagnostic sectors. So thinking of your solutions like your X-ray, CT scans and the rest. We are aware of the brain drain that is happening on the African continent. We don't really have a lot of highly qualified radiologists on the continent. So we have some innovators who are developing these solutions whereby our lab technicians that are currently here on the continent can relate with senior colleagues who are maybe outside the continent, or even if bringing it back to the local communities now. Imagine a primary healthcare center in the local community, and then we have at the national level a tertiary hospital. So there are solutions available for these radiologists to collaborate together. You do your X-ray and then you transmit the results to a senior colleague to review, and then they send the results back. So it's really pretty amazing.
Yeah, well, what about the online pharmacies? How does that work? We know that the online pharmacies attracted about 38% of all funding last year. But how does it work?
COVID was an eye-opener for everyone, and seeing the effect that it had on logistics systems. So these innovators basically just leverage on the normal pharmacy model that we have. Instead of walking out to your local pharmacy to purchase a medicine, you can just basically go on your phone, download an app, order your medications, and then it gets delivered to you. There are even some companies who are offering services where we know patients need medications on a recurring or maybe every month. And so you can subscribe to their platforms, and then every month they send your medications to your homes. And so it's really amazing. And also these online pharmacies, aside from serving the consumers, they also help. We have some who we refer to as the online pharmacy aggregators. So they provide the technology infrastructure for local pharmacies now, who are the physical brick and mortar pharmacies, to basically digitize their operations. And so they partner with a multitude of pharmacies, and then just distribute these products across the continent, or the country, as the case may be.
Yeah, but my fear is for a continent that is dealing with insufficient infrastructural funding. And we know by the time you go you go online and all of that, you need strong infrastructure. How do we, grow on this with this challenge?
So one thing that has been interesting in the online pharmacy space is to see the government actually stepping up to prepare regulations, to guide the operations of online pharmacy operators. Using Ghana, for example, they've kind of built this national infrastructure where all online pharmacy operators need to sign up on the platform. They are registered, make sure they are licensed, and that's also just to prevent like a stopgap in terms of product quality assurance, to make sure that these online pharmacy operators are regulated and patients are having access to high quality services. So we've seen even in Nigeria in 2021, the online pharmacy regulations was released. And in fact, as early last year, there was a review of the regulations, and we are hoping that by the time all stakeholders come together and are able to come to an agreement on that, that will be enacted.
So, I mean, you mentioned Ghana, you mentioned Nigeria, and these, as well as Kenya, Egypt, they seem to be where the funds are concentrated. Is it because of the population? What's the attraction, and how do we sustain that funding?
Yes, Nigeria, Kenya, and Egypt, they accounted for 87% of the total funding. So they stand out as key hubs for these health tech innovators. So maybe the population plays a role in that. But then we're seeing this concentration of health tech innovations actually being headquartered in these countries. Nigeria was a top player, accounting for 35% of the total funding, followed by Kenya and Egypt. And also the top innovators that got the most funding this year actually headquartered in these countries. Take, for example, Helium Melt in Nigeria. They raised $30 million and they are headquartered in Nigeria. And then in Kenya, we have Kasha, an online pharmacy, and also Maidawa that raised 21 million and 20 million. And also in Egypt, we see companies like Yodawi, Shefa, and Maisha raising large, vast amounts of money. And so they are headquartered here. So these top innovators being headquartered here kind of like just makes the funding to be concentrated in these regions.
So this is coming from the private sector. You talked about regulation. Ghana has started. I think you also mentioned Nigeria. How can the government bring, regulation to because investors will also need assurance, of your investment. They're investors, they want to make profit. So what kind of regulation do you see to bring about, organization, certainty, and sustenance of this flow?
We're already seeing a lot of traction. I mean, on African governments, they've released the ICT policy framework, the guiding digital health operations. But even just stepping back away from the health tech, I think the general IT policies that they have, and even their data protection laws, health tech innovators definitely have to abide by that. And then if we now narrow it, coming back again now to the digital health operations, looking at the activities, of investors in this space, actually betting on these innovators, I mean, that's a signal to show that these innovators are primed for skills. And so there's opportunity for government to collaborate with also investors. Just look at which companies are being funded, what are their operations like, what are the challenges, And so there's need for that forum to bring these different stakeholders into the room and just ideate and look for, explore opportunities for synergy.
So these opportunities, is it just anyone that can tap into it? Because it sounds like it's a huge investment opportunity that requires a large overhead or initial investment.
Well, I mean, it depends on your solution. The African continent is not, will I say, empty of its challenges, especially when we look at the healthcare space. We've seen these amazing innovators ideate and even innovate despite the challenges. So one of the things we're seeing last year, we saw that about 77% of the funding was actually directed to early stage investment, so at the pre-seed and seed stage. So it goes to show that investors are willing to support these kind of nascent and early stage companies. So it's for you to kind of look at around your environment, identify what the top healthcare challenges are, come up with your solution. There are a lot of incubator programs that are targeted towards African tech innovators. If to highlight one, there's the Investing in Innovation program, which every year they announce a cohort of 30 health tech companies that they provide with grants of $50,000. So that is a good avenue to access funding to basically kickstart your idea.
All right. Thank you so much, Zila Waminaje, consultant with Salient Advisory. Thank you for sharing those opportunities, with everyone who would love to take advantage of it.
Thank you. I'm happy to hear.